My name's Tim and this is Amy, and we're going to show you how to put through a vancomycin infusion. First of all, we're going to need an IV line, which has also got the two parts for the pump, because we're going to infuse this through a pump.
And this is the vancomycin, and then we've got our sodium chloride bag,
which the vancomycin is to go through.
And
we're going to make up the vancomycin first with some saline into a 10ml syringe, and then we're going to put it through this bag.
And we've got our label all identified, what antibiotic is going in the sodium chloride. Okay.
And let's get started. So first of all, we're going to make up the vancomycin, and I'm going to check the date. 2013.
Yep. I'll check the expiry. 2013.
2013. Always make sure that there's two nurses checking the drug. And always make sure to swab over the vial.
So now I'm just making up the vancomycin. And just mix it until it's all diluted.
And we also make sure we leave the syringe and that all intact to reduce risk of any bugs or bacteria.
And needle stick injuries.
And needle stick. Now, next thing is, we then put the syringe into here, so we make sure we swab over this part of the bag.
Thank you, Tim.
So that's our 500 milligrams of vancomycin in 100 mils of saline.
Okay, now I'm just putting this into the shops.
And next we have to infuse the line.
So I'm hanging up my bag, and then I've got to get my label to put on the bag here.
And also make sure the clamp's off. Prime line. Alright, ready to go. Now what we're going to do next is put this through the pump. Okay. Hi Mr. X, we're just going to, my name's Tim, this is Amy, we're just going to put a little IV infusion through, just with some antibiotics. Now if you have any rash or tingling sensation or irritation on that arm, please let us know as soon as possible.
And we'll just check the site for patency or any redness.
And we also grab the drug chart. So this is Mr. X. Mr. X, date of birth is the 1st of the 1st, 1986.
Yep.
And his UR number is 654321.
All good.
Okay?
Yep.
Now first things first, we swab this site. We swab the cannula first, just making sure we reduce the risk of any bacteria. And we attach this. This is a lure lock. And we also give this infusion over 60 minutes because of hypersensitivity, as it's a very powerful antibiotic.
And we'd also do the 5 rights of drugs before we administer it.
Okay, now next bit is the rate. So what we want is, we want 100 mils to go through 60 minutes. So we set the rate at 60. And the volume to infuse is 100, but generally, as a rule of thumb, we say about 98 to stop any air coming through it. Now, as you can see, we've got 60 minutes. We want 98 mils of that 100 mils to go through, and then we start. Make sure the clamp's unlocked.
Okay, and that's running.
And we start. And that's now running through. Also make sure label's on, and always make sure it's on the back so you can still read the front. And there we just sign, we check the date.
So the right date, and we've given vancomycin 500 milligrams and 8 AM, so we're just both going to sign it.
Flush, this is 500 milligrams of flucloxacillin,
Yeah, like
which
the order.
expires on the 11th in 2013.
Yeah, perfect.
Flucloxacillin 500
100
milligrams at 8.
Yeah.
So I'll just 10 mils of water to mix it with. It's not very much in here. Okay. Okay. Now I'll just get you to check that one more time.
Yeah. So
We've got
water for injection.
10
Oh,
mils.
this is supposed to be normal saline.
This is normal saline, which it is. 10 mils for our
Yeah.
flush. Expiry date on that one is fine. And
Yep, December 13th.
our Fluclox, which
Yep,
has been
500 milligrams.
Yep. Fabulous. Okay. We've just come to administer your flucloxacillin, which is an antibiotic,
I'm Erin and I'll be one of your nurses.
and I'm Sophie. Now, we're just going to check your armband and make sure you're the person that you're supposed to be. You are number 654321. Yep. Simon, and your date of birth is the 1st of the 1st, 1986.
Perfect.
Not a problem. Okay.
Alright. Just gonna swipe the side.
Now, after we've given you this, if you feel itchy at all or have a rash anywhere, just let us know.
So this said that we had to give it over 3 to
3
4.
to 5 minutes. It's a slow push, so it's going to take a little while.
We're going to check the site to see if it's patent and not tissued. And
Is there any pain to the site, Mr. X? Okay, that's good. Everything looks pretty good.
yeah, everything looks pretty good. So I'm
It's
gonna
not red or anything.
do a little bit of put some normal saline in there just to flush it. So this is going to be over 3 to 4 minutes. I'm just flushing the line down.
Thank you very much, Mr. X. Let us know if there's anything else we can get for you. Okay, so blue clock's given at 8. There we go. Can sign there. And just show the camera signatures. There we go. Thank you.
So this is our group discussion, and we've just watched our video back, and there are some things that we did wrong, like that we could have said and we forgot to. So the first one.
So one element was that we forgot to ask the patient initially if they had any allergies and check if they had a red band on.
We should have probably discussed more what the patient's condition was, so it was more clear why we were giving the antibiotics that we were giving, which is important to know why you're giving a drug, not just giving it when you're not sure what the point of it is.
We should have asked the patient for consent, because we didn't actually see if the patient consented to the medication.
I also should have put in the fact that when you're running the concentration, you do it as a concentration, not just say on, then the medication. Have it as a whole when you're priming the line.
Overall, we think that we did a pretty good job. I don't think we left out many big important things. So yeah.